This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, welcome to a new year of Behind the Headlines. I'm Maura, an associate of the Susquehanna Valley Center for Public Policy. My co-host today is Dave Atkinson. Welcome, Dave. Dave is an associate of the center as well. Our usual host, Charlie Greenwald, is on assignment. So thank you so much for filling in today.
Good way to start the new year.
Well, we're going to start the new year talking about a big topic, something on everybody's mind, and that's healthcare. And to join us today, we have a brand new guest with us today, Dr. Sari Siegel, who is the Vice President of Healthcare Research at the Hospital and Health System Association of Pennsylvania. Welcome, Sari.
Thank you. Nice to be here.
Well, we're going to talk about a report that was recently issued by HAP. But before we do that, let's learn a little bit about you. Tell us a little bit about your background and what you do for HAP.
Absolutely. So I am the Vice President for Healthcare Research, as you mentioned. I have been in the role for about a year and a half. I moved to Pennsylvania from D.C. for this role. I had been in D.C. for 25 years. I worked for the government for the Department of Health and Human Services. And I also had a very similar role with the research department at America's Essential Hospitals, which is the National Safety Net Hospital Association. So this is all very familiar work that I'm doing.
Well, that's great. Welcome to Pennsylvania.
Thank you so much.
Well, I mentioned the report. You recently did a report. So tell us a little bit about how the report came about, what prompted it, and give us a little bit of background, then we'll get into the details of the report.
Sure. So we do a report every year to look at the economic contributions of hospitals across Pennsylvania. And this year we decided to do something a little bit differently. We are looking at it in a little bit more of a broad perspective. Everybody knows the contributions that hospitals make from a clinical perspective to public health and to the health and welfare of the population that the hospital serves. But what's a little more subtle is the economic contributions and what it is that hospitals are doing to bolster the Pennsylvania economy. And that's really what we're delving into and looking at lots of different angles, both how hospitals directly support the economy with salaries and benefits for employees, as well as how money trickles through the economy that funds other segments of the economy. So we looked a little bit more broadly.
Sari, when we mentioned we have a report that's chock full of statistics, people at home are probably diving for their remotes right now. But so can you tell us what the meaning is of the numbers and how it factors into the debates that Pennsylvania will be having on health care in 2020?
Yeah, absolutely. One of the things that I think is very important to remember as we're thinking about hospitals and what they provide to Pennsylvania is that they are open 24 hours a day, 7 days a week. And there is an infrastructure on the ready for any emergency that should ever occur. And so to support that infrastructure, we really need to look at what it is that, from a policy perspective, can support the sustainability and the continuation of these hospitals and secure funding for these hospitals going forward. What this report tells us is that it's far more than patient care that hospitals provide. What it really shows us is that in the 20 most rural counties in this state, hospitals are the #1 employer. In 85% of counties across the state, hospitals are among the top 10 largest employers. So
that's pretty significant.
That's what we found, right? And that's one of the things that I think is very interesting and exciting about this report is that it really shows throughout the state the role that hospitals are playing. So as we enter the budget season and start thinking about funding and secure funding for OB units, for NICUs, for critical access hospitals, these are some of the areas that we are hopeful that we will be helping to educate lawmakers and the public about and how critical it is to maintain that.
Well, somebody said, okay, what are the 3 most encouraging things that you found in this? What would you say?
The 3 most encouraging things. I would say, first of all, the total economic impact of hospitals across the entire state of Pennsylvania is $136.1 billion, billion with a B. So it's a huge impact. We support 1 out of every 10 jobs across the state. It's actually about 11% of the Pennsylvania workforce that has a job that is supported by the hospital industry. And so given that magnitude of impact, I think it's really important as we are looking at the legislative session and looking at opportunities for reforms that really ensure the sustainability of these hospitals. So that's one of the exciting things that I think we found in this report is just, and to me that was really one of the most surprising things, is how interrelated hospital funding is to funding and support of the economy as a whole.
So of that 136.1 billion total impact, 32.3 billion is wages, just direct wages to the employees of the hospitals.
That's right. And then those employees use those wages to purchase goods and services,
buy
and
donuts.
It ripples through to buy donuts, to buy
Coffee,
lunch
go
at
to
the
Starbucks.
local.
Yeah.
Exactly.
Yes.
Exactly.
So you get that ripple effect of
That's exactly right.
those people being employed,
right,
which is phenomenal.
Right. And it's not just the clinicians. It's another point I found really interesting is that when I think about hospitals and who they employ and how their dollars are spent, I think about direct patient care, but there's also a whole host of other services. There's construction workers, there's building maintenance, there's food service workers, environmental services. So there's a whole broad range of different types of people.
And then there's vendors that support the hospitals.
That's
as well.
right.
Well, and there has to be tech support too, because
Oh,
we're,
yeah.
we're, in
IT.
we're in the age where
That's exactly
Yeah.
right.
Just the security alone would be some pretty good jobs right there.
That's exactly right. And a lot of those are small businesses that are owned by in the community locally. So we're really supporting local business that the hospital outsources to for parking services or laundry services, those sorts of things.
So what does this report mean for smaller communities? We have a lot of small hospitals in small communities. What does this report tell you about that?
Well, it really emphasizes how important hospitals are, again, not just to expand access to care and ensure access to care, but the implications for the economy. If a hospital in a rural area, in a small area closes, it has tremendous implications for public health and for access to care, but it also has implications in that this may be the largest employer in that county, and with that closing, that's a lot of jobs and a lot less dollars circulating through the economy.
Well, we recently did a report on some state policies and some technology advances that could be very important to the sustaining of the rural hospitals, which have a lot of challenges. So if you're in a community that hosts a community hospital, a small rural hospital, what do you find in here that is encouraging for the future?
What do I find in the report that's encouraging for small hospitals? I think that it's that message, that core message, that hospitals provide so much to the community, well beyond patient care, but of course including patient care. In a small community, looking at the access that they provide, we think about patients and people in the community who would, without having access to care, would not be able to go to work. People that, when they're ill, if they don't have easy access to medication, to physicians, to clinicians to help them get better, that has significant implications as well. So I think one of the main messages to me that's encouraging about smaller hospitals is that it's really a great message to say to everyone, small hospitals are providing so much to the community. And so as we enter this new legislative session, I think it's important to think about what it is that we can do as a state, from policymakers, what policymakers can do to ensure that these hospitals, especially in these smaller rural areas where their margins are razor thin and so many hospitals work on negative operating margins, that they can keep their doors open.
So the report also was somewhat forward-looking. We've seen tremendous growth over the last decade, but they're also looking forward. That's very encouraging, especially for a lot of these rural communities as well.
That's right. That's right. And one of the things that we did for the first time in this report is we looked longitudinally over the last 10 years, and we saw substantial growth, 50-something%, 55% growth over the last 10 years in jobs primarily in rural areas. So I think that's also very encouraging.
And that we talked the numbers, the raw numbers, but we're talking about 290, almost 300,000 jobs across the state. That's pretty phenomenal.
I think that's right. Looking across the state, it's a tremendous impact. And again, hitting all
that's
sectors.
Just direct jobs. That does not count the ripple effect, which probably would be more like 370, closer to 370,000.
That's exactly right.
Those are nothing to sneeze at, basically.
That's exactly
huge
right.
numbers.
That's exactly right.
Well, the same is true of the economic impact, because that number that you cited, that's about 4 times roughly the state budget. And so people think of the state budget with education and health care and all that in it. And it's a big number. You always hear people say, geez, the state budget, there's so much money in there and everything. Well, we're talking about an economic impact from one sector of the economy that's four times as large as the state budget.
Yes, and
that's pretty impressive.
That's right. That's right. And in states that have larger rural areas, hospitals have a greater impact because they are, in many cases, the largest employer.
Wow. So did you see any or acknowledge any trends or forecasts coming up in the report?
One of the things that we've noticed in looking longitudinally in the past and then projecting forward is the demographic changes in the state, and particularly in rural areas, that they are older than the state as a whole. And Pennsylvania's population is a little bit older than the national average. So we're really looking at patients that are more likely to have more complex medical needs. And so the demand for hospital services is only going up. And in rural areas, we are seeing that exponentially. We're seeing the growth of the older population.
And Pennsylvania is known for their research in healthcare. And so there's a significant portion of money that comes into this state for research alone.
Thank you so much for mentioning that. That's exactly right. It's an enormous amount of money that is coming in. In last year alone, in 2018, it was $1.8 billion that came in federal grants, federal research grants, primarily from the National Institutes of Health. And that is funding that members of the hospital community, researchers within hospitals, apply for and bring into the state. And it's really a testament to the fantastic resources that we have, the world-renowned physicians and other clinicians around the state.
Yeah. At the end of the Constitutional Convention, someone asked Ben Franklin about the sun on the chair and whether it was a rising or a setting sun. So as I listened to you describe this report, my conclusion, and hopefully the conclusion of other people, is that for health care in Pennsylvania and for hospitals in Pennsylvania, it is a rising sun.
I think that's right. I think that's a good...
Hug your local hospital.
Hug your local hospital, indeed. Indeed.
Well, we really want to thank you so much for being here today. We'll probably have to have you back to follow up on how the research is going and whether it's proving out. But we want to thank you so much for being here.
Thank you so much. And I'd like to also just mention that if anybody is interested in taking a look at the report, we have it up on our website.
Great.
It's www.haponline.org, haponline.org. And on that website, there's also an interactive version of the report. There's a dashboard that will allow you to look at the economic impact of your region and compare it to other regions, as well as by congressional district. So you can see how your hospital's economic impact is in your specific district. So
that's great.
Look forward to any questions you have, and look forward to
Terrific.
having you take a look at our report.
Well, thank you, Sari, for being here. We really appreciate all the information you provided us today.
Thank you.
Stay tuned for the next segment of Behind the Headlines.
Behind the Headlines is brought to you as a public service by the Pennsylvania State Association of Township Supervisors, the largest, most influential municipal association in the Commonwealth. Since 1921, PSATS has been preserving and strengthening township government and securing greater visibility and involvement for townships in the state and federal political arenas. Covering 95% of Pennsylvania's land mass, townships represent 5.5 million residents, more than any other type of political subdivision in Pennsylvania. Behind the Headlines is also brought to you by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Chamber of Business and Industry, the The Pennsylvania Chamber serves as the frontline advocate for business on Pennsylvania's Capitol Hill by influencing the legislative, regulatory, and judicial branches of state government. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Welcome back. On this segment, Dave and I are joined by the President of the United Way of Pennsylvania, Ms. Kristen Rotz. Welcome to the show.
Thank you. It's great to be here.
Well, we're really pleased to talk about a new program that you have going, but let's tell our viewers a little bit about the United Way of Pennsylvania and the role that you play on a statewide basis here.
Yes. So United Way of Pennsylvania is a statewide membership organization. We have 52 local United Ways in the state of Pennsylvania. They're raising about $170 million that they're investing back in their communities across the Commonwealth. So they're locally governed. We as a statewide organization, they choose to be members of our organization, and we perform several functions on their behalf. We do some advocacy at the state and federal level, and we're also doing training and education and helping them kind of cross-pollinate good ideas to generate more impact across the state.
So does in the 52 locals, does that really cover all of Pennsylvania?
The vast majority of Pennsylvania has its own local United Way, yes. There are a couple of counties up in the northern tier that do not.
That's pretty
Kristen,
awesome.
there are probably few brand names that have the recognition the United Way does, but a lot of people probably think of the way United Way used to be, where it was a dispenser of dollars. And so there's been quite a transformation to make the United Ways more partners in achieving results. So can you describe how that has come about?
Yes. So the unique positioning of United Way is really that we bring together business leaders, and we bring together labor leaders, and we bring together people from across the community who want to address problems. So the historical model of United Way is thought of as I donate money through my paycheck, and I know that United Way is going to pass that money through to a certain set of organizations in the community that I also believe in and support. United Way is evolving and taking a look more now at how to achieve true community impact and actually get to the root cause of some of the very complicated challenges that our communities face. The beauty of it being local is the struggles in Schuylkill County are different from the struggles in Dauphin County and Clearfield County. So local United Ways have the ability to really dig into the data and see what's going on in their communities and come up with solutions to help.
So speaking of data, let's talk about Alice.
Yes.
Alice, is it a recent report, or how old is Alice?
The Alice report was released for the first time in Pennsylvania in June.
In June, very
Yes,
new, of
so it's
2019.
pretty new, of 2019.
Yes.
Yes.
Tell us what Alice stands for and what the report says about Pennsylvania and the local communities.
Yes. So ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. It's a very long string of words to say this is the story of everybody in our state who's going to work every day and doing all the things they should be doing, but still struggling to meet the basic needs for their family. So for every household in every county in the state, we have proposed a survival budget, which represents those things that if you're only paying for the things you absolutely must have as a family, we can quantify what income level you would need to pay for those things based on the configuration of your household.
So it would be different in every county, pretty much?
It is different in every county based on cost of living in that local area. So the things that vary locally could be cost of housing, could be some variation in cost of childcare as well.
And are people meeting that survival income?
Yeah, what our study shows us is that unfortunately we have 37% of Pennsylvania households that are struggling to survive. That consists of 24% of our state's households who are earning an income that's above the federal poverty level but less than the survival budget. And then we've got another 13% of our state's households who actually earn below the federal poverty level. And again, we're focusing in this study only on those Pennsylvanians who are working.
So can we talk a little bit about that gap? If you're above the federal poverty level, but you're still not reaching that survival budget, what's happening to these families?
Yeah, so what's happening is they're doing their best to get by, but they're one emergency away from poverty. So these are folks who may be just making it paying the bills, but they're not having any extras. They're not taking their family out to eat. They're probably having a hard time putting sneakers on the kids' feet and putting new clothes on their backs to go to school. They don't qualify for many, if any, public programs. Even things like the Earned Income Tax Credit and the Child Tax Credit may not be available to them depending on the income that they live on. So they may be relying on family for extra support. They may just be relying on luck. Alice often lives in a situation where one emergency can throw them way off balance, and whether that's the normal things that happen, like hitting a pothole and getting a flat tire, or the furnace breaking in your home, Alice is not banked for those kinds of emergencies because Alice, living below the survival budget, doesn't have any income to save on a monthly basis. So we say they're one emergency away from poverty.
Wow.
This is really a revelation to a lot of people because we frame the debate in terms of poverty level, in terms of minimum wage, and people say, well, geez, the economy's improving. There are jobs out there. People who want to work can find a job.
And they are working.
But finding a job is much different than holding a job.
Right. And paying all the bills,
and
yeah.
successfully holding a job. And so this program makes a lot of sense, but it's also taking the discussion in a direction that people are not accustomed to hearing about.
Yeah, and Alice is a familiar concept. We know Alice. Our family members are Alice. Our neighbors are Alice. But to have something that measures this very objectively, I think, is what's pretty groundbreaking about it. And we're also the 20th state to launch an Alice report. Since then, another state has joined. There are 21 Alice reports across the country. We know that Pennsylvania's Alice average is about on par with the national average. The national average is 39% of households living at or below the survival budget. So it is true that there are many ways to look at the health of the economy, things like the unemployment rate, things like the GDP, but we think this Alice measure is a really good way to look at the health of working class families across the country.
Can we talk just for a second about the average four-people family, mom, dad, 2 kids, and the cost of childcare? That's one of the biggest factors here.
Childcare is a huge cost driver in Alice budgets. So for a family of 4 with 2 very young children, childcare is going to be about 25% of the cost of a survival budget. Now, not all of these families are going to qualify for child care subsidies either. In Pennsylvania, you can qualify for a child care subsidy and kind of earn your way up out of it. But there's still a tremendous impact that hits when you don't have that child care subsidy in your budget on a monthly basis. This is also just kind of the basic minimum child care, making sure the child is safe every day, but it's not a high quality setting. When you look at the cost of high quality child care, that actually bumps up to 30% of the cost of a survival budget. So for families who have both parents in the workforce, which is certainly the case for most Alice households, because they're looking to earn, for that family of 4, they need to earn a total of about $30 an hour gross to be able to meet their survival budget. So you, in most cases, are going to need 2 working adults in a household to be able to meet that threshold.
So in terms of numbers, I think I read it was like around $1,200 a month for childcare for.
Yes, for a family of 4 with 2 young children, it is about $1,200 a month.
And I think our viewers would, relate to that.
Yeah,
that's a mortgage payment. That's a rent payment. That's in addition. That's
well, and the
very high.
other thing is that what Alice shows, these issues are not independent issues to be considered one at a time, because transportation is another big concern too.
Yeah.
And if you're in a rural area, it's not only transportation to work, it's transportation to childcare wherever it may exist. And so distance is a consideration. If you're in an urban area, it's the cost of transportation. Distance isn't so much a consideration as is a cost. And so transportation, I guess, is one of the big problems needing to be solved in providing a sustaining budget for families.
Yeah, we see 2 big barriers for Alice, and those are childcare and transportation. And the issues do vary depending on where you live in the state, but the fascinating thing is this is an issue no matter where you live in Pennsylvania. If you live in a rural area, mass transit is not sustainable. We've got to find other solutions to get working families into transportation they can afford, that's reliable, and will get them to work. If you live in an urban area where you have great access to mass transit, which frankly only exists in about 3 counties in Pennsylvania. But even if you have that benefit, it's going to take you more time to get the kids where they need to be before you get to the work that you need to do every day. And it can really affect family schedules in terms of when they have to leave their home just to cross all those hurdles to get to work every day, which has an impact on the business community as well, which is why we're really encouraging a cross-sector approach to this. Business to look at creative things, the nonprofit sector to look at creative ways to support ALICE, and government has a role in this as well.
So ALICE is a report. It's chock full of data on every county in Pennsylvania. What's next? How do we fix this?
Yes, so we are working to support our local United Ways to scale up solutions from the local level. We are learning about things that are working from that local United Ways are leading. We're learning about things that the business community is doing that are innovations that are working. So we just want to keep finding these things. We want to scale them up to a regional and statewide level. We at United Way of Pennsylvania will continue to advocate for policy change that supports ALICE. That includes better investments in the child care subsidy program. We would like to advocate for a statewide earned income tax credit, which would also benefit ALICE families in Pennsylvania. So there's a lot of different prongs to this approach. We're also going to continue to update the data. We want to keep tabs on this and see how ALICE is improving or not in Pennsylvania every year. So we're going to refresh this data every 2 years, and we'll actually get another chance to look at this very late in 2020 and see how it's going.
That's a good point, because we live in a skeptical age, and people say, okay, where's the accountability? Any kind of program that involves taxpayer dollars, involves organizations outside government cooperating with government, where's the accountability? And so that kind of update, you've given part of an answer, but somebody says, where's the accountability? What's the response?
Well, the accountability, interestingly, with this work, when we first put this data in front of our local United Ways, they were kind of overwhelmed because they are very stark numbers to look at. However, you got to almost start family by family, and you got to help families move to a sustainable level so they can continue on through their lives and be able to really sustain themselves as a family. So we're starting with a hyper-local approach, looking at some of these state and federal policy solutions that also impact ALICE, and we hope that as people are preparing for presidential election this year, they will think about what candidates are talking about and how it impacts the ALICE population. We all need ALICE. ALICE supports the quality of life we sustain every day. They work places that we enter every day. So we need to make sure that everyone's thinking about ALICE.
And Kristen, where can people go for additional information to view the county by county data on this ALICE report?
Yeah, so if you go to our website, www.uwp.org/ALICE, there are a number of things there, including an interactive map that shows where ALICE lives. ALICE lives in every county in Pennsylvania, pretty much every municipality in Pennsylvania, and there's also county level budget sheets there as well for people to take a look at.
Well, that's wonderful. We want to thank you so much for being here today. We look forward to getting an update on how ALICE is doing, and especially how changes are being implemented on a statewide basis.
Great. Thank you. Thanks for having me.
Thanks for joining us on Behind the Headlines. We'll see you next time.